Good morning and welcome to another weekly update. We do a live Q&A here. My name is Talon Ellsworth. I'm the practice manager at Tustin Longevity Center in Orange County, California, and I'm joined by our medical director and founder, Dr. Rita Ellsworth. This is live. If you're watching us right now, we encourage you to participate. You'll see a chat section on your right, I believe. So if you are logged into YouTube, please feel free to post any health questions that you have, and we will be monitoring those and answering those as we go. Hi, Dr. Ellsworth. How are you doing today?
I'm doing great, and I'm always happy to do this. Remember, we started these videos last year with the idea that for our patient base, we wanted to be talking about how an integrative, standard-trained allopathic physician looks at treating their patients and bringing in more natural methods first. And then we said we always wanted to address timely issues. And then, of course, coronavirus is a timely issue that we get lots of questions about. So we do have some updates as well.
We do? What do we have today?
Well, again, if you remember on the first video we did on the updates last month, we pointed out that there are some good resources for you to refer to check on your own on the internet. And I brought up John Hopkins' map of the coronavirus. It's a updated on about every 2-hour basis worldwide map. It's called John Hopkins Coronavirus map, okay? And then it's interactive. You can look at the whole world and you can see the incidence of the coronavirus cases. You can follow the trends of the new cases. You can follow the trends of the recoveries and total deaths. So this is an excellent source for you to be checking. A second source that I had brought up subsequent to our first video on that is Medcram, M-E-D-C-R-A-M, Medcram. Medcram is put out by a pulmonologist and intensive care specialist, Dr. Sleuth, and he is updating this almost daily. And he's talking about various modalities that are being used in trying to treat the coronavirus, and I thought I would talk about a few of those. But, you know, we've been talking about the things that we can do.
Yes. And
we've been going over, why don't you mention what, you know, that we can do here?
Absolutely. Well, first we want to start off by saying what we're being told and what we certainly believe is for most Americans, even here in Orange County, the risk is still classified as low. I know this is all over the news, everybody's talking about it, but your risk of contracting coronavirus is still relatively extremely low. You have a exponentially higher chance of catching the regular flu than you do to coronavirus. And as well, this is really a higher risk for individuals with a compromised immune system or the elderly, right?
And that's what we would say anyway in any situation.
With any virus, exactly right. So we don't want to over-exaggerate, but we do want to address this in reality and talk about what we are doing and what we can do. So starting with the simplest things, it sounds obvious, but make sure you're practicing good hygiene, washing your hands regularly, not touching your face. I know I touch my face a lot, and now I'm very conscious of that because we're talking about that a lot. We tell all our patients to eat a diet low in carbohydrates, certainly in sugars, and that includes fruit sugars. For instance, I know a lot of Americans begin their day with a big glass of orange juice, and we're not talking even the little 8-ounce glass. It's usually a large pint of orange juice. A glass of orange juice has, I believe, somewhere around 30 grams of sugar in it. That's not far away from a Coca-Cola.
Right.
And we know that 6 teaspoons of sugar can depress your immune system, knock out about 50% of your immune system, right?
Yeah, for almost 10 hours.
For almost 10 hours. So orange juice is not your friend, certainly during flu season or coronavirus season. We'd much rather see you hydrate your body with just pure, plain old water. So don't reach for the orange juice in the morning, reach for a glass of water, and stay hydrated throughout the day. That is going to help your immune system in many, many ways. And stay away from carbohydrates and sugar. This is not the time to be indulging in sweets. So we want to see you eat healthy proteins, healthy fats, leafy green vegetables, a simple diet. I'm not adding a lot of variety to my diet, Italian, Chinese. I'm just trying to eat very clean and very simply right now.
And sleep.
And sleep, yes. Don't underestimate the importance of decreasing stress and getting as much sleep and rest, because that's the time of the day where our bodies go back to work on healing and repairing. So those are sort of some of the basics. What we are telling our patients to do, and you certainly should be doing right now, is considering coming in for an IV. If you feel that you're going to be in an immune compromised scenario, or if you've got to go to work or be around crowds, come in and get IVs. I've been taking advantage of that. I've had to be doing some travel lately.
Right.
I have allergies. You might hear it in my voice right now. My throat is a little sore, so I'm just doing everything I can to get that 100% bioavailable infusion of high-dose vitamin C, of chelation therapy to increase circulation, which is going to lead to my next point of delivering the micronutrients to my body from my diet, but also supplementation. So I've made sure that my family's stocked up on high-dose vitamin D, on some things that have vitamin A in them, vitamin K, K2, and vitamin C.
And then the studies we brought on our last videos, they are actually doing studies now on vitamin C intravenous for the coronavirus, and the early indicators are very favorable. They have 3 studies going on intravenous high-dose vitamin C. They have a 6-gram IV, they have a 12-gram IV. We can take in walk-ins, right?
We can, yes. So you don't have to be a patient here at Tustin Longevity Center to come and get one of these wonderful IVs. We do accept walk-ins, and I would call ahead just to make sure that we have an appointment available for you, but you don't have to see a physician first. You can just come in and get our immunity IV, which has all kinds of things in it, zinc, selenium, as well as the main ingredient, high-dose vitamin C that has 12,500 milligrams, I believe, of ascorbic acid in there.
Right. Well, our nurses do a brief history and physical
Yes.
on anyone that is a walk-in, and we doctors do sign them off.
Right. And I will mention as well, just kind of bringing this back to coronavirus, we're telling our staff, we're telling our patients, if you believe that you're coming down with something, that you're ill, before you just go straight into your doctor's office or straight to the urgent care, pick up the phone and call and just find out what their protocol is, and give them a chance to talk about your symptoms with you, because depending on what your symptoms are, they might give you one piece of information versus another.
Right. The early indicators of coronavirus when it first developed, remember this is a new virus, and so if you're saying where are test kits and all that, it's a new virus. And we only became aware of it in January. We're talking 9-10 weeks ago. And the mere fact that we now actually have in our abilities test kits to screen for the genome of the coronavirus, as well as the standard flu. And this is, I think, a fantastic thing that we have that ability. So it's available here in the clinician's reach now, and primarily it's the emergency room and the urgent care staff that is going to be using this. But as a outpatient general practice, we are encouraging you to talk to the worried well, and that's why we're doing this. Again, Talon was saying this is still considered a low risk. You're more likely to get the flu, the standard flu. And when we talk about all these health measures, rest and adequate sleep and water, low carb, take vitamin D, high dose for 5 days, but always keep your standard vitamin D, take your vitamin C orally, you could take supplementally. They actually are conducting studies in China on oral vitamin C too as well, for the well as a prevention. And there are studies showing with severe respiratory distress syndrome, acute respiratory distress syndrome I had brought up on other videos, that high-dose vitamin C had made a significant impact in the death rate from severe acute respiratory distress syndrome. So we're talking about things that have research, or ongoing research. And now we do know that there are vaccine companies all working, and pharmaceuticals to develop vaccines, plus treatments. And I want to talk a little bit about that.
Sure.
If you go to some articles that are now coming out, and these are articles, journals that you would not necessarily hear about. These are in the obscure viral research and pathogen research articles. And you can get this on MedCram, okay? So I want to bring up what is being discussed in MedCram, and that is about zinc. Zinc is an essential nutrient that has been found to actually inhibit the replication of the RNA polymerase, okay? So it's RNA-dependent RNA polymerase enzymes that makes copies of this bad coronavirus. Simple zinc. Now, I've been practicing about 40 years, and I have, in addition to standard medicine, been also very involved in preventative integrative medicine. And over the years, I have found not only is magnesium deficient in the general population, probably the largest one, but zinc also is deficient. Now, zinc is a ion. Zinc is a positive metallic ion, and it has to be transported across the membrane. And the membrane of the cell is made of a bilipid, and you know we've published on this. It's got an outer hydrophilic, and the inside of the membrane is water-hating or hydrophobic. And in order to come across the membrane, just taking zinc in large doses is not necessarily the solution. And I have done lectures and I think some videos on our mineral supplement here. Our zinc is chelated, and to say the term chelated means it's joined together with amino acids from a reputable company that does publications on the transport through membranes of minerals. So these are things I have fun studying. And so zinc transportation is much better as a amino acid chelate. And so of course our standard multivitamin TLC Energy Core has the zinc adequate dosing in it already. That's about 5 milligrams. The Viricid that we also have, which has the herbal components that have also been studied to be effective against virus in general, the flu in general, even against Tamiflu studies, was shown very positive. It also contains 4 milligrams of a chelated zinc in it. Now, what's so interesting is they actually showed in this article November 4th, 2010, long before this virus ever showed up, but they were looking at the SARS virus back then, very similar. And it inhibited, the title of it is Zinc Inhibits Coronavirus and Arterivirus, there are other viruses, RNA Polymerase. And the author is Artjan, A-A-R-T-J-A-N, capital A-A-R-T-J-A-N, and his first initials are J and then middle initial W, and his other co-author is T. Veluthis, and let me spell that, T-E-V-E-L-T-H-U-I-S. And so they published this article that indeed showed the tremendous reduction in the coronatype viruses after adequate zinc was introduced intracellularly. It was just an absolute die-off. It was really exciting. Now, another thing is there's an article talking about things that help deliver zinc into the cell. And one of the interesting things was there's an old drug called chloroquine. And chloroquine has been used for half a century for malaria. Remember, you've heard about malaria prophylaxis if you go to those countries, mosquito-borne pathogen. And so chloroquine is a carrier that allows zinc to get into the cells very nicely as well. And actually now there's a publication, October 1, 2014. This is from the University of Oklahoma. Again, it's PLOS pathogens, and so it's an obscure research article that chloroquine is a zinc ionophore. Author is Jing Z, Jing, capital X-U-E is the last name, X-U-E, and Amanda Moyer, Amanda M-O-Y-E-R. So they published that October 1st, 2014 in PLOS / pathogens article out of the University of Oklahoma, confirming the zinc's power in stopping the RNA-dependent RNA polymerase enzymes that replicates these bad corona-type viruses. So this is well established, and another reason why I do mineral assays on my patients. Final article I have here is the Korea Biomedical Review, and this was February 13th, 2020, so it's quite up to date. And the title of the article is Physicians Work Out Treatment Guidelines for Coronavirus. And in it, they are using chloroquine, and they're using it in the form of hydroxychloroquine. Okay? China is also using it. They're referencing some of the China studies. And in the China studies, they're using 500 milligrams twice a day for about 10 days. And in the South Korean study, they're using 500 milligrams once a day. And they are giving these to basically people who are sick with fever, cough, feeling short of breath, the ill, severely ill, and critically ill. But they are also using the vitamin C IVs as well. But I just wanted to let you know about zinc. I wanted to let you know about chloroquine. Hydroxychloroquine is probably more easy to get a hold of. And then I wanted to tell you that there are also studies in South Korea where they are using, as I mentioned in our very first video on the coronavirus, this is a virus and it's in the same family as HIV. And we have anti-HIV medications, remdesivir I had brought out before. And remdesivir is involved in messing up the replication process of copying the corona RNA. Okay, so it messes up that transcription if it starts to occur. And that's where you have remdesivir and some other HIV and antiviral medications having benefit. And so I want to tell you that the test kits are available, the risk is low, good old-fashioned personal responsibility to wash your hands, to not get into crowded situations and cough on people. Please have a handkerchief or tissues or carry a mask. And to be mindful of the elderly and of the people who have secondary severe conditions, severe asthmatics and severe diabetics. And so otherwise, I would enjoy your day-to-day and your fellowship and your work or your studying or whatever you're doing today. But we have a lot that's out there in addition to just good old-fashioned healthy preventive measures.
We have a lot in our toolbox here at Tesla Longevity Center. A lot of things that we're recommending you can do at home. And just to mention, I think partly just due to the somewhat panic and fear of COVID-19, the novel coronavirus, that we're seeing runs on supply. So we're doing the best we can to stock up on the things that we know make a difference from these reputable evidence-based companies. So that when we talk about vitamin D and zinc and some of these supplementations and certainly the sterile compounds that we make our IV bags with, these are not things that you will typically be buying off the shelf at a vitamin store like GNC. And maybe there's nothing wrong with those, but our doctors decided to carry these things in the office originally because the supplementation industry is just so under-regulated, and it's hit or miss. So we've chosen to partner with companies that produce quality products that are third-party tested, and they're actually use that product in research, in studies,
and we travel to these sites.
And we go and visit
Literally.
these manufacturers as well too. So I would recommend, just because of the fear of this, to go ahead and stock up for your family on high dose vitamin D, on a good multivitamin mineral such as TLC Energy Core, and come in and get an IV. Do that regularly if you can. Let's see. And then when it comes to the diet, stay away from sugars. Make sure you're hydrated, get plenty of sleep. Yes. Okay, it looks like we do have a couple questions coming in, so we'll go ahead and answer some of those. Got a question about zinc. So, are zinc acetate lozenges also useful to prevent or treat COVID?
Well, where are the double-blind studies? You have to understand that much of food research doesn't make anybody money. So we don't have those kind of studies. So you have to go with doctors such as myself that have endeavored to do clinical assays of their patients. And I would say for the most part, my patients, I have many in their 80s and 90s and some at 100, who I've been following for decades, and their rate of getting illnesses and colds. So the isolated research is there. The human clinical trials do not exist on zinc and coronavirus. So I would say zinc acetate is probably a logical thing and helpful to use.
Right. I think my personal opinion is I'm trying to be mindful. As I said earlier, I have a little bit of allergies, and I'm coughing from time to time, and I don't want people around me to worry. So I am sucking on a lozenge from time to time, and I would personally take a zinc acetate lozenge just preventatively. Do we know that that's the best form of a chelated zinc? No, but it's certainly better than nothing.
Right.
Okay, next question. If I have taken 5 days of vitamin D, 50,000 IUs, how long after that is it safe to again take another 5 to 7 days of 50,000 IU vitamin D?
I would do it no more than once a month at that level. You should be on a maintenance dose, more than likely, of anywhere between 5,000 international units with vitamin K2 to 10,000 international units. I take 15,000 international units for many years, and I have not seen, in my entire years, 40 years, I've seen one case of an elevated vitamin D. It is fat soluble, so you have to be cautious. I saw one case, and of course they stopped it and they totally recovered. So I would say once a month is your limit of taking 50,000 once a day for 5 days.
Okay, thanks for that answer. And another question, how often should you get a vitamin C IV?
Well, I like to take it for stress, and stress dampens your immune system. And I like to get it once a month is what I do in general. When I feel like I'm ill, and about a month ago I had a flu-type virus, and I had 5 IVs, and I had them over the course of 7 days. And I did very well, and I would be in that category of above 65 and up, so I'm in that elderly group, and I did quite fine. And that brings to mind, you have to be mindful of the healthcare people, the staff. We are here, and we are here to help you. And I honor all the first responders and the healthcare people out there who come to work. They have the same concerns that you do, but we show up, and we are trusting too in our healthy diet, our sleep, our water, our low carb lifestyle, our vitamin D, our zinc mineral, multivitamin and minerals, and we are enjoying our life, but we have that concern in the back of our mind, and so we welcome your prayers.
Yes, thank you. And I think just to wrap that question up about how often the vitamin C IV, we have patients that come in 3 times a week. If I'm feeling ill, I'm doing it 3 times a week. Vitamin C is a water-soluble vitamin, so you're not storing it. There's no major concern for toxicity.
And zinc is water-soluble, so you can't store that either. Now, I don't think I would go above, I don't think I would take a standard 5 milligram zinc. High dose would be 30 milligrams or higher, and I don't know that I would do that for a long period of time, say over a week or 2. So I think prevention is good. Be on a good, well-researched, that's what we do for our multivitamin nutrients. So we're looking ahead. Long before coronavirus came, we were looking at having the vitamin C's ready, having vitamin D ready for you, getting you on a good multi-mineral chelate that makes a difference, and so forth.
And let me just jump in because we did get a string of a few follow-up questions here, and we have a few minutes left, so we want to do our best to try to answer those. The next question is, how effective is liposomal vitamin C versus IV vitamin C?
It isn't studied enough. See, there isn't money going into nutritional research the way it should. Now, I am going to tell you that I think liposomal vitamin C is water soluble. Liposomal means it's wrapped in a fat, okay? And that's in my NT factor. I'm well published in this. Liposomal is a good product. I would definitely use a liposomal vitamin C if you cannot get into an IV. Can it approach the level of a 25 or a 12.5 gram IV? It's a guess, but I'm going to say it will come close to the lower dose IV infusions, and so I think it's a valid product.
Okay, I hope that answers your question. Next one is, when I use the Vitality C that we have here,
right,
I get stomach cramps. Any advice?
Well, the side effect of oral vitamin C high dose is a stimulatory effect on the bowels and loose stool. Advice would be use less, okay? So a full scoop of Vitality C has 4 grams of vitamin C. Mm-hmm. Cut it in half, see if you can tolerate that better. Another thing I do is I mix my vitamin C with OptiMag Neuro, again, another Albion orthomolecular based, and we've gone out there and researched it. Magnesium, yeah, that's a magnesium.
Right, that one's by Zymogen, the OptiMag Neuro.
Oh, excuse me, Zymogen. And I mix them together, and it's more relaxing to the stomach. So if you get a crampy stomach or something, magnesium relaxes it. Right. But it sounds like you need to reduce your dose.
And if I couldn't get in for an IV vitamin C regularly or at all, I would just try to spread that oral vitamin C throughout the day. You can only tolerate so much vitamin C orally. So spread it out through the day, cut it in half, maybe half in the morning, half at lunch. Mm-hmm. But back off if you're starting to get that GI upset, because that's to be expected. In fact, some people do that if they're feeling constipated. They just up their vitamin C and voila. Mm-hmm. Okay. I've got, looks like maybe 2 questions more here. When do I take D-Flame, the TLC D-Flame? Can I take it with my Vascuzyme in the morning?
Yes. TLC D-Flame is one of my private labeled nutrients that is an herbal turmeric curcumin based high dosed for an anti-inflammatory, very helpful for the entire gut wall. And VitalZyme is a systemic enzyme taken on an empty stomach. The two work synergistically, so it's a very good thing.
Okay. Great. And so they could take that with their VitalZyme. Mm-hmm. They could also take it with food. There's no reason why you couldn't take the TLC D-Flame with food.
Right.
Now, VitalZyme, make sure you do take on an empty stomach. Any systemic enzymes such as Vascuzyme, take on an empty stomach. Mm-hmm. Okay. Well, I think we just got a couple thanks for, it's a pleasure. We love answering your questions here. We'll be here again next Wednesday at 9:45 a.m. We look forward to your questions. If you have any questions in between now and next Wednesday, email them into the office. We'll try to address those at the front end, or just join us early and post your questions in the chat here.
Are we going to do another detox Choristar?
We don't have a date for that yet, but I'm sure we will, so keep your eyes peeled.
I lost 3 more pounds, so I want to
Congratulations.
Yeah.
If you're not already signed up for our email newsletter, go to tlcdoctors.com and look for the Sign Me Up. That's where we will make our major announcements there.
Okay, and it'll be coming soon, I hope.
Yeah, it will.
There's one more question.
Oh, one more question? Okay. Blake said we got one more question. What would you recommend for someone with histamine intolerance?
Well, that's antihistamines are what you take for histamine intolerance, and we have things like D-Hist. D-Hist is a natural herbal product. It's got quercetin in it and other items that are calming for the allergies. I take it every day. My son, unfortunately, picked up my high allergies. I'm B positive. If you do research on B positive blood types, we have the highest reactive, itchy, tearing, sneezing, seasonal, mold sensitivity. So I use D-Hist all the time, and I take 2 every morning throughout the year. I never stop it. I would do that.
Drink a lot of water, and if you're in our area and you can come in, we also can test for a wide variety of allergens, dietary, environmental, and I do want to mention that we have sublingual immunotherapy, which some of our patients says has just been a huge relief.
Yes, so it's a mast cell stabilizer acts as an antihistamine. Yeah,
right, and that's called allergan.
AllerDHQ.
No, the sublingual immunotherapy that we do.
Allerend.
Allergy end. Yes, that's it. Allergy end. Right.
Allerend.
Right.
Yes.
So we can test you, and then depending on the results of those tests,
right,
you might be appropriate for this.
Homeopathic.
Yes,
we make this stuff up. I use it as it comes to around late July. I start using my Allerend drops, 1 drop twice a day, to help my membranes as well as taking my D-Hist and so forth.
All right, well, I think that's about all the time that we have for questions today. Thank you so much for joining us. Thanks for participating and asking your questions. We look forward to seeing you next Wednesday at 9:45 a.m. Pacific. Thank you.